Hello, dear students. Today we will have a very interesting topic about the antenatal prevention of the dental caries in children. And we will speak about the prevention of dental diseases, and it is our department of pediatric therapeutic dentistry and prevention of dental diseases. We have many articles, and we learn this topic very well. So, what we need to know about the enamel development defects, yes, and when we have such picture and we can see such clinical cases, according to the clinical picture, can be classified into. You can see our picture and enamel hyperplasia also. So during the pregnancy, women may face many new and often uncomfortable health issues as the months tick by. From swollen feet and an aversion to previously loved food, many of the thin women will may face are often explained away as being just because you're pregnant. But when it comes to when pregnancy comes to the life, our oral health have some problems that we need to know and learn very well for our future practice. And we have different causes, yes, and such as respiratory distress syndrome, malnutrition, hypocalcemia, mineral deficiency, and other. Sometimes our patients have a local traumas, and big percent of them have infection in utero and newborns. And we need to study of priority risk factors that affect the development of caries of temporary teeth in children in the antenatal period of development. And we have such methods for pregnant women. And for example, on this picture, you can see a card of the hospital and form number 113. And of course, we'll speak about the methods for pregnant women, and it is first of all evaluation of actual nutrition, and that a pregnant woman using 24 hours nutrition recording for the 7 days. And of course, you can see such card, special card, where our pregnant woman can write nutrition during 24 hours. Of course, as with anybody's oral health, prevention is always much better than a cure when it comes to looking after mouth. And a good oral health routine should involve a brushing, last seen at night, and at least one other time during the day with a fluoride toothpaste, daily interdental cleaning, and of course, regular visits to the dentist. There are three other if it's pregnant woman in the hospitals. And about the method, so we need to research methods in pregnant women, and first of all, it's clinical methods, study of the carriers, definition oral hygiene, and study condition of periodontal tissues. Why of periodontal tissues? Because of course, pregnant women have problems with the bleeding of gums and gum diseases, and changing hormonal levels during pregnancy mean that body of this woman will react differently to bacteria on the teeth or on plaque of the teeth. And this can lead to swelling and bleeding gums, and even to the more seriously form of gums disease such as periodontitis and pregnancy gingivitis. There have been prone links between gum diseases and adverse pregnancy outcomes, with a greater risk of preeclampsia, premature birth, and of giving birth to an underweight child. It is therefore vital, and pregnant women do not ignore any early signs of gums diseases and get checked out by a dental professional straight away. And it's very often when pregnant women have a pregnancy gingivitis. Next method, it's laboratory. So we can do microcrystallization of oral fluid, and we can use microscope and have analyze of cultural examination of oral fluid. And statistical research methods, they obtained digital data were processed statistically, and of course we use these statistics data because we need to understand how many percent of the pregnant women have some problems, for example, with the gums, and how many percent pregnant women have problems, for example, only bleeding gums without the exacerbation of the gum or gingivitis. And we need to examine it's our article, and 211 pregnant women examined from 18 to 45 years, and in this group average age stayed 23 years, and correlation of our results, 63 pregnant women and 63 children. And correlation, of course, weight connection, it's age. First of all, it's age of pregnant woman, and then the course of pregnancy, some intensity of carriers of pregnant woman, and of course, different criteria. And strong connection, it's look to this table, and you can see the number of diseases. And here we have balance of the diet, malnutrition, proportion of the proteins, of the fat, of carbohydrates, and of course hygiene of the oral cavity, nutrient cholesterol, yes, and permanent components of the fatty products. It's of course butter, beef fat, animals' brains, then eggs, and different nutrition supplements. For example, when we go to the mass market, to the supermarket, and we buy the meal, we buy different products. we need to read them different additional things in these products. And for example, here you have nutritional supplements such as E369 and E450. And for example, first it's meat products, then fish, marmalade, pastilles, drinks, milk, and the second table, here also meat products, some bacon, jams, semi-finished products, and chocolate and different sweets. And the purpose of the study to study in experiments the influence of dietary cholesterol factor, so food additives on the expression of matrix, RNA, and on morphological changes in the rudiments of the teeth of mouse embryo. So look again. So these nutritional supplements, and we can have some changes in the future. For example, in this article, it's rudiments of the teeth of mouse embryos. And experimental research methods. So it is our professor, and total number of animals, it's 18 female mice and 20 male mice. And groups of experimental animals. Here you can see 3 groups and 20 animals. And control, its control group, here also 20 animals. Here female mice. And we have on this picture 1 week, 2 days, 1 week, 2 days, 2 weeks, 4 weeks, and 3 weeks. And such materials for research, we can see lower jaws, and we use some molecular genetic research, quantitative assessment expression, and analyzing all the obtained data. And after this, we have first results of the experimental group number 1. So high diet cholesterol enhances expression the BMP2 gene, and we have acceleration odontogenesis. So we have acceleration. Here it's control, and here it's results of the high diet cholesterol. Then here also control and a low hypercholesterol diet. And we have decreased gene expression and osteoclastin on 22 and 3%. That is in with reduced of mineralization. We use a microscope, and we can see such preparate. And it is our results of the attention leads group 1 and morphological studies of the embryo of the tooth of a 17 weeks old mouse embryo of an experimental group that fed on excess content cholesterol. And results of the group, second group. In the jaws of animals at pyrophosphate diet, it's remember additional E450 expression level, BMP2 did not differ in the control and experimental group. So it's control group and a pyrophosphate diet. Expression level of calcine increased at pyrophosphate diet 1.8 times and was equal to 51 and 2 plus and minus 6.20. And premature mineralization disrupted tooth growth and entire process of odontogenesis. And you can see pictures of the results in the second group. Here, the teeth of 17-week-old embryos of mouse, and group number 3, the rudiment of the teeth of 17 weeks old embryos of mice of experimental group. The purpose of the study to study in experimental the effects of dietary factor cholesterol, food additives on the chemical composition and surface structure of enamel of teeth in mouse. And of course, X-ray dispersion spectral analysis of enamel. So you can see E450 and raster electron microscopy, and we can see such pictures. The surface layer of the tooth enamel of 28 days old mouse. And the results, so you can see such tables. It's chemical composition of the surface layers of the tooth enamel of 2 days old mouse. And here are chemical elements and quantitative composition of the samples. So the critical level is considered to be a ratio before 1.33. And it is picture of the surface layer of enamel of 28 days old of mouse. So you can see the tooth and enamel layer. And the second table, its second group, it is also chemical elements and qualitative composition of samples. So look, please. The critical levels is considered to be a ratio before 1.33. Their third group and also 2 days old mice, and here is ratio can be 1.33. And surface layer of enamel 28 days. It is surface of enamel in the picture. Then prevention of the dental caries and dental anomalies is the unborn child is necessarily in the antenatal period, when pregnant women have, for example, poor nutrition, and this reason is reflected in those organs of the fetus, which this period are late and develop. And we have other part of our lecture.